Well, it's a good question, Kate, and it's both a simple answer and a complicated answer. The simple answer really is, of course, the Obamacare is going to put more costs on businesses because it essentially requires employers to do certain things, and when you require employers to do things, that's going to drive up costs. It'll probably impact the smaller businesses more than the larger businesses because most large businesses do carry health insurance already, and so there's going to be a lot of administrative costs and technicalities to figure out in terms of compliance with Obamacare. The smaller businesses, though, will have to determine, should we come up with a health care package that meets the requirements of the law, which of course is going to cost money, or do we opt out and pay the fine? Either way, it's going to cost money. Look, one can argue that's a right thing or a wrong thing to do, and obviously some people say, well, we need to spread the cost of health insurance across the world, so yeah, we're going to put costs on small business and they're going to pay for part of that. We're not quite sure that's an equitable way of imposing mandates that the government wants to impose, but in any case, clearly businesses are going to face more costs than they didn't have before. Can they pass that on to the consumers? Sometimes some businesses will be able to do that. I think the restaurant industry has been mixed. Some have said they're going to be able to pass that on. Other ones have said, no, we're going to take certain steps to come below the employer mandate, such as cutting full-time workers to part-time workers. So every business is going to have to look at this individually, but there's no question on a macro basis it's going to add costs to small businesses and businesses in general. Obviously, a big debate in Washington is whether that's the right thing to do or not, and what isn't exactly the effect on competitiveness and the ability of employers to grow.